There we go. Hello, hello, hello. Thank you and welcome to the Free Your Thinking platform. This is Sean Speaks with the Up Talk My Life podcast. And today I have some special guests. This is a special edition because I have 3 guests on the platform today. And we're going to be talking all things COVID-19, all things coronavirus. And they know what they're talking about because they have more knowledge and more wisdom than we do. And so I want to invite to the platform Dr. Nichole Fleming Cole, Dr. Berthrone L, and Dr. Damarcus Baymon. Thank you so much for being on this platform.
Thank you.
Thank you.
Yay! I'm so excited to have y'all here. But this is definitely a serious conversation. I do like to take things a little light sometimes. So I'm sure that as we're talking seriously, I may throw out a few jokes here or there, or at least what I think is funny. And as many of you may know, I love to redefine words and change words up. So right today, even though we're talking about coronavirus, I also wanted to be a little bit of a corona therapy session so that we could become corona worry-free. So during this corona time. So I just like to kind of play with words because I think as we redefine words, we redefine our lives. And despite the fact that we're going through a difficult time right now, right, we still each have authority over this body that we're experiencing for however long we get to breathe in and out in it, right? And so I just want to welcome each of you to the platform. I want you to know that I am very grateful that you took out time on this happy Sunday to speak with me and to speak with my audience. And so I just want to say welcome, welcome, and welcome. All right, so I can't do it justice. I'm going to let each of you do it justice of introducing yourself to my audience. And I'm going to start with Dr. Nichole Fleming Cole. Thank you.
Hi, I'm Dr. Nichole Fleming Cole. I'm an obstetrician-gynecologist. I've been out in private practice in suburban Houston, West Houston, Katy, Texas, for almost 18 years now. I have a very busy OB-GYN practice out here. See probably about 200 plus patients a week in my private practice. Deliver probably about 15 babies a month. Do tons of minor surgeries, major surgeries per month. And COVID-19 has deeply affected my practice in the way I'm practicing medicine. So I'm glad to be here to talk more about this today.
Thank you, thank you, thank you. Dr. Mark Muhammad?
Yes, good day, good morning. Happy Sunday. My name is Dr. Berthrone L. Yes, my name is Dr. Berthrone L, and of course, my practice is in Ridgeland, Mississippi, north of Jackson, Mississippi, and I'm a cardiologist, but an internal medicine physician with heart failure, transplant, and EP cardiology background. My clinic and practice, of course, is a multi-specialty practice, integrated healthcare system that integrates naturopathic remedies as well as behavioral health modifications and therapies that aim at treating that heart patient that has all of these particular modalities. I'm also on the radio, local radio show. I have a Facebook Live audience as well that have germinated, and this subject matter is certainly timely indeed. And having my voice being hoarse now, I've been talking so many times on it, so I'm filled with information, but I can't wait to get into it.
Great, thank you. And Dr. Damarcus Baymon.
Hi, I'm Dr. Damarcus Baymon. I am a third-year resident in the Harvard-affiliated emergency medicine. I am in Boston, Massachusetts, and have been, a resident, so definitely working a lot. And so COVID has really taken over my life in terms of how I interact with patients every day. It's very acute. It's very short. It's high acuity, high stress. And so, this disease process has really, helped me kind of come and attack patients very, gingerly, but also too, I have to do what I need to do to make sure that they're protected. And so this disease process to me is a high acuity disease process.
Thank you. Welcome, welcome. All right. So this is probably one of the first times on my podcast where I'm probably going to say the least. I'm a super talkative person. But I don't know anything. And I can be scared, and I am scared. And I know that there's people that are going to be watching this that are scared, but I don't like to live my life in fear. I like to be informed, but I don't want to be worried, especially if it's stuff that I can't control. So I want to kind of get down to sort of the heart of, can you tell us, each of you, in your own words or in however you see it, what is COVID-19? What is the coronavirus? Whoever wants to chime in first.
I'll start first. So coronavirus itself is a virus that we're very familiar with. We've had two other types of viruses that are very similar to what we're going through right now. However, the difference between this virus versus things like influenza is this virus presents completely differently. Typically with influenza, you're symptomatic, quickly or enough to where you're able to actually do something about it. We have medication for influenza. I mean, we still have a large number of people who die from influenza, but this virus is completely different in the fact that the latency period, meaning that the time that you're infected until the time that you're actually symptomatic, is such a long time that you can actually infect, a huge number of people without even knowing that you're affecting people. Mm-hmm. And like you mentioned before, everyone's immune systems are different. So my immune system may be completely different than yours. I may be completely asymptomatic, but if you have other medical issues or medical problems, or if you're pregnant, your immune system may not be able to respond in an effective manner to actually be able to fight this off. As of right now, we do not have a cure. We do not have a true medication for this. There's lots of things that are out on the horizon. But it's scary. I mean, it's really scary because by the time you're symptomatic, you've possibly had the virus for 5 to 7 days. And even after you've been infected with it, once you're not officially cleared from it until you have 2 negative results. So this is a long process. I've never seen anything in my medical career that's affected our whole nation or that has been pandemic like this. And it's, scary from our end as well, too.
Wow. Okay, I just want to chime on something that you said. You said you have to have 2 negative, even after you have it and you're cured, quote unquote, cured from it, or you think you've overcome it, you've still got to clear 2 more negative tests. Now, is that 2 more negative tests over what period of time?
So here's the thing, Sean. So you may have COVID and you may go through your, week or 2 weeks of miserable symptoms and all of a sudden feel like, oh, wow, I'm feeling better now. But you can still shed the viral particles. And so until you are completely negative ×2, you are still considered infectious. So if you're going back out into the community again, thinking, okay, and I have a prime example of this. I'm trying to do my social distancing as much as I can. I had my groceries delivered. My grocery deliverer person told my family that she just got over COVID. That freaked me out because in my mind, I'm thinking, what is her definition of getting over COVID? My definition is 2 negative test results mean that you're no longer infectious. Just because you may now not have symptoms anymore does not mean that you're not still infectious. So in my mind, I'm thinking this is how this spreads so easily because she's thinking that she's feeling better, so therefore she must be cured, but that's not factual.
So how long would you recommend someone who, because I have a couple of clients that have it, after they feel like they're better now, and what's the time frame between when they need to go back and get another test?
Can I?
Anybody want to chime in? Yeah.
Well, to answer that question.
Let me. I understand if you don't. I know that there's different guidance that's coming out all the time, and so if you don't have a definitive answer, I'm totally okay with you saying, sure. I don't know, or we're still figuring that out. I'm totally understand. I just want the audience to understand because I did not know that. So Dr. Cole, you just informed me of something that I don't think I've ever heard, that you need to clear 2 more negatives before you really are clear or before you're no longer infectious, because that could be part of the problem. Because I'm thinking if I feel better, well, shoot, I feel better. I didn't got over it. I'm gonna go to the grocery store and now I'm endangering other people. And I know that that's not what I would want to do or no one else would want to do. So this is great information. Thank you for that. Now, what were you about to say, Dr. Mark Muhammad?
Yes, I first want to echo Dr. Cole's response and support that. That's a wise way in order to recommend. but I wanted to go back on a couple of things because there's a lot just in that. First and foremost, the way the test is done, there's a lot of scrutiny and controversy on how the test is performed. So if the test is not performed right, the test has to be performed in a way where the person doing it has to stick basically a probe into the nostril, take it all the way back to the pharynx. That's very painful. So if you're not doing it properly and just do it on the outskirts, you're not going to get enough material in order to be able to confirm that you have it. And there's a lot of false negatives that are out there. And particularly, there are some I know of patients of which that I've had in my clinic, or people who I've taken care of in the healthcare arena, who were nurses that had clear viral related activity going on in their body. They had a negative flu screen. Okay, that's the usual flu. And they had negative pneumonia and a negative strep. And of course, by virtue of that, I had them wear a mask, but their test came back negative. Now, I treated them as a corona patient until proven otherwise. So during that period of growth in your body, you are actually vulnerable to projecting that to others. In fact, and this is going to be a scary point that I'm going to say, in the earliest stages where you don't even have symptoms, your high infectivity rate or spread is highest. So when you start getting symptoms, at that point, your body is now fighting it and your viral load is going down. So imagine that 3 to 4 or 5 days before you're experiencing that.
Yeah, and that's true. That's the immunity phase of it. And so there's two different types of components to this virus, and and to echo both of you all's points, it is something that we have to be aware of in the testing. I've had patients that I've had to test 3 times, and they have CAT scans that come back and it's clearly coronavirus, and you treat them as coronavirus, but you cannot depend on these tests. People aren't talking about the gold standard test, and that's to take the secretions out of your lungs and to test them in a culture. That's the gold standard. So this nasal swab, just like you guys are talking about, you have to get all the way back. I had to hold a patient down and we talked about it, and we said, this is very important. We have to do this properly. It's going to hurt. Exactly. It's going to hurt. And so, to Dr. Cole and to Dr. Muhammad's point, it has to be done right. And it is something that clinically, this is why we train as doctors, because a test is not 100%. And so just being careful of who you're around and who you infect is so important to preventing the spread.
Exactly.
So it sounds like what I'm hearing is, this is where your training plus your education plus your training and then your learning all combined, because you are now in a situation where you really can't necessarily 100% rely on the test. So you've got to rely on what you're seeing, what you know to be true from the symptoms, and that gut that, what, your test may have come back negative, but I'm still going to treat you with caution, for not just for your sake and for my sake and for everybody else around you. But Dr. Muhammad, you did say something that was kind of scary. You're saying that at the beginning stages, you said something, it was scary and hopeful at the same time. At the beginning stages where I'm beginning to have some symptoms, my body is going through its attack of that virus coming on, right?
Yeah. Yes.
But at the same time, I'm the highest level of infectious to other people. Did I hear you correctly on that?
Right. During the period that you actually don't display the highest symptoms, you actually are higher in terms of infecting others. This is why they've come down on the aspect of cloth-related barriers. I've been preaching that on the radio shows, and people thought I was crazy. They said, this is the bandana doctor that's out there. This is almost a month ago, where I've been studying very closely what's going on in the Middle East and what's going on in China. China has a tremendous amount of data that they have going out. And I'm just going to say this for the record and your listeners, really a problem that we have here in America is that we are arrogant. We're arrogant with our knowledge. We're arrogant with research. And we think that our particular points of peer research reviewed are just the glory of the world. That's great. But even beyond peer research, we have flogged data. And what is happening is that when you have a situation like what we're having, you have to get data from all over the world to determine what is best for us. So we knew then early in China that cloth, meaning cloth from clothing, that the virus doesn't like it. So it doesn't grow well on it. So what other barrier would be than a cloth barrier to use? if you don't have anything else. We know that heat and other things were going on relating to that. So what I'm saying is that people should be wearing those cloth barriers, period, whether they go out, et cetera, because in a room, just speaking and talking and singing would bring that particular point. And you don't know yet that you are infected because we did not do enough testing yet to determine how pervasive it is. So even the crinkling in my voice and what people are calling that is pollen, we know that is more pervasive than you think. And just to put a real point on it, even to this day now, I have consults in hospitals, and my colleagues right now are saying, look, I'll cover you on that COVID patient that's a prisoner. Don't go in there because I don't want both of us sick. They have young children, and we're trying to say that if you're sick, then who's going to be the backup to you, et cetera, et cetera, et cetera. So it is a serious, serious pandemic. And I want to let the listeners know what you can do is stay in your homes, wear cloth barriers if you need to go out for emergencies, wash down everything, and we'll talk about those parameters later. But the fact of the matter is empower yourself with the fact that if you can get through this particular symptom and this illness, your body will develop antibodies that are more stronger than anything that they will put on the market. But you have to live through it. Your immune system has to be strong enough to be able to work down the virus over time, and your body would then develop these immune systems that would actually put antibodies out to fight it. It would fight the head, the leg, the thigh, every part of the virus over time. But if you bombard it with it at once, it can kill you and kill you quite quickly. And Dr. Baymon, I wanted to ask his opinions related toward ER encounters. We've had a couple of patients that have come in that were, quote, negative, but came back in 3 days later. Some of them did not get the intubation to be put because they died instantly in the waiting room, just to be able to get them up to the actual ICU to put the intubation in. When it hits you, and it hits you typically at night, a lot of coughing. The coughing is usually not wet at first. It's dry. It's usually upper respiratory, like a sinus infection or something along that line. And then it manifests in things like chest pain, which is why I get the call. Patient got chest pain, and we're like, well, chest pain with a dry cough, what is it? And so these symptoms, you have to make sure they're not masquerading, but you treat them as corona until proven otherwise. And I have, just as a side piece to let the others jump in, I have started using off-label use of hydroxychloroquine, as well as some other concoctions that I have read on with anecdotal evidence. Go ahead. Oops.
I think we just need to, can we just, let me soak that in. I just need to soak that in. Okay. I'm sorry, Dr. Baymon, you can go.
No, I was just about to say, the interesting part is this disease process is so variable. Patients come in with upper respiratory symptoms, cough, cold, runny nose. I've seen patients present with, they pass out. They have a syncope on themselves, and they're positive. I've had patients who present with like chest pain that goes into the back, which would suggest that, there's something going on with the artery. They're positive. And so this disease process is very interesting in how it presents in different patients. And then also too, I've had patients with the multiple negative tests. And what people are not talking about is the CAT scan is actually a more sensitive test than the swab. Now, the CAT scan is expensive. Everyone does not need to get a CAT scan. So hear me when I say that. Everyone does not need to be rolling through a scanner. There's radiation risk. But those are things that, if you're symptomatic, can help us in terms of how we treat you. And the intubation part is a scarier, component of the disease. And so if you can get through the disease process, you develop those antibodies and you develop that attack onto the immune system that can then help you for the future. And then also too, and I'm gonna, pass it along. There are a lot of patients with, diabetes that we're seeing who are also affected, and patients who have higher, BMIs. And so there's a component of this virus that is probably a little bit different in America because of, our size and our risk factors and such like that. So I think keeping those things in mind as well.
Okay, I got a lot I want to unpack with both what Dr. Muhammad said and what Dr. Baymon said, but Dr. Cole, I want you to chime in because y'all are really, you're not scaring me, you're informing me, you're empowering me, and you're also, you're giving me that knowledge that I need to know how I can help myself and how I can make sure that I don't hurt others.
Mhm.
So Dr. Cole, I'm gonna let you chime in.
So my experience is completely different from Dr. Baymon's and Dr. Muhammad because I'm mostly outpatient. So I am actually somewhat doing the exact opposite of them. I, at this point, am not allowing anyone in my office who has any symptoms. And it's all due to the nature of what I do. I mean, I have the most vulnerable patients in my practice that literally if someone comes in with suspected symptoms or, or what we call PUIs, people under investigation, you could potentially, affect now a pregnant patient. And possibly at this point, we have very little knowledge about whether or not there's what we call vertical transmission to their unborn fetus. So, so there's a lot of unknown information in the pregnancy arena. So I'm doing the exact opposite of what, my other two counterparts are talking about, because I don't want these patients coming into my office. If someone calls me with what sounds like COVID symptoms, I'm immediately referring them back to the ER or back to their primary care doctor, because I'm really trying to keep my office free of anyone that's suspicious at all, because it really affects everything. So my situation is completely different. I'm dealing, but what's still a little scary from my end is I could be potentially dealing with the people that are positive but asymptomatic, so that may be what I'm dealing with right now, and I just don't know it. So that from my standpoint is a little scary, because again, you can feel completely normal for days. So that may be my population of people that I'm dealing with. I'm not dealing with acute COVID patients.
Gotcha. Okay, so y'all threw out some words here that I want to kind of unpack a little bit. I want to go back to. Let's start here with the power of our bodies. I want to talk about that first, right? And Dr. Muhammad, you said something that I think people need to understand, is that our bodies are self-healing machines, but sometimes we need help. Would that be a fair, accurate Sean statement, right? That's a Sean statement, right?
Mm-hmm. Yes.
But the reason why I'm saying that is because you made a statement, Dr. Muhammad, and then you, Dr. Baymon, you backed them up on it. You said that, our bodies will produce antibodies, and correct me if I'm using the wrong language, antibodies that will eventually be able to fight off, or at least, create some physical internal barriers to fight off this disease, right? You made the statement, Dr. Muhammad, but we got to live through it. We got to live through this initial onslaught of this disease, so that our bodies can do what it does, which, act as a healing machine from within. But it's going to take some time. Is there anything we as human beings can do to help our bodies sort of build these antibodies now?
Correct. So I would take it attached like this.
Okay.
Part of what, before we get into that part, I think it's helpful for your listeners, is to understand a couple of things historically that about the origin of it, because I know people are going to ask about wording and what things mean, and we're going to get right into that. How much time do we have? Because
we have as much time as you all will give to me. We normally try to do the podcast for about an hour, but I think that this topic is such a sensitive topic. If we go over an hour, I'm perfectly fine. I just want to try to give as much information, because honestly, we could shut it off right now. You've already helped me, because some stuff I didn't know, and now I know, and I don't want to put somebody else in danger. I don't want to be going into the grocery store not having my mouth covered and my nose covered, and let's say I got a strong immune system, right? And my body's fighting it, but I'm more infectious to somebody else. I don't want to endanger anybody. So you've helped me right now. So I thank all of you all for that.
Absolutely. So let's go back, I guess, into the terms COVID and 19, about what that means.
Okay.
COVID, stands for coronavirus. ID 2019 is when it was first, quote, identified. Now, the corona, why is it called corona? Because it has spikes. When you look at an ultra microscope that looks down into it, an electronic microscope, you look at it, it has spikes on the heads of the virus, and people think about That's corona. That's a crown, which is in Latin. So that's where the term comes from, corona. Now, people say, okay, well, is that the first coronavirus? No, there have been coronaviruses identified since the 1950s. Okay, so I know when people look at their Lysol bottle and they look at what is on the internet a lot about, hey, how do they know about corona? Is it a conspiracy? Well, I'll leave the conspiracy out for those that have that, because myself, I have my own opinion on it, but I'm a scientist, I'm a doctor as well, and I rely on data and facts. So we'll talk offline about conspiracy. That'll be a whole nother show, okay, to talk about that. But dealing with the
I love the conspiracy now. That's another show. Okay.
Yeah, we can deal definitely into that. But to tell the audience that definitely coronaviruses are zoonotic viruses that have been out since that time. In the recent time, it has been transferred to humans, and that version of that is conspiracy as to how that occurred. Now, the other thing I want to talk about, there are other related viruses, and one common fallacy is that people think that coronavirus is a flu. It's not the flu. The flu is different. You had an avian flu, which grew out of China, and that was due to some birds. And then, of course, the common flu, the seasonal flu. But coronavirus is not the flu, even though it can manifest in flu-like symptoms and pneumonia, et cetera, which is very similar. So I'm just getting particular about what we use in terms of terms. MERS. MERS is a similar virus along with SARS that developed. MERS stands for Middle Eastern virus. I forgot the actual term, but Middle Eastern is that. And it came from a camel. Believe it or not, the semen of a camel. So how does the semen of a camel have anything to do with the fact of this virus? But I know people who eat camels, that is a delicacy, okay? And so maybe that's the reason why. Again, conspiracy, different show, okay? But that's where it came from. Now, the other one is SARS, came from, correct me if I'm right, or not, cats. So that was a zoonotic virus that came from cats, okay? And SARS stands for severe acute respiratory, I think, syndrome or so. But that's a virus as well. Now, coronavirus, or the COVID-19, last check supposedly came from a bat, but then we also hear that it has some elements of a snake as well. So again, these particular modalities are interesting to say, and they lead to a whole lot of conspiracy things. But I would say this is interesting from a scientific perspective. The virus has receptors called angiotensin converting enzyme inhibitors. Why is that important? If you hear that to a cardiologist, that's the receptor that we use to fight off high blood pressure in patients that we use medications called ARBs. Now, there's been some hope on the use of certain antihypertensives like losartan to treat that. And again, they're having studies to go over all of these things. But it's interesting that, wow, something so as simple as that, but we know that receptor can really, really change quite a bit with all types of changes that the receptor can do in making it difficult to treat. And so I wanted to start from that perspective and then move into the standpoint of immunity and what we can do to boost that immunity. So when you're talking about health in general, your body makes antibodies in two different major types, one called IgM, the other called IgG. Now, IgM is like memory one, and those are made from the bone marrow. They're the first ones that kind of come out when your body is trying to attack. And then the IgG is the largest amount that comes from the body in the bloodstream that is continuing to attack whatever the virus or the bacteria, etc. Now, what I'm saying about the standpoint that you can get through the illness, you can get through the illness in the standpoint that your body over time would develop antibodies that would then learn how and what it did to treat that. And then it will be a memory cell that will come back and say, boom, I got it now, make up this antibody, and boom, we're going to fight that infection. And you can then have a surviving chance against it. Now, I said that to say, what is the difference between an antibody that you make and a vaccination? Because there may be another question that comes out. Because what's getting ready to happen, and again, I don't want to take over the show as well. Trust me, you all jump in there or so and stop me, because my colleagues, I respect them both in it. It's just that I've researched this part in it, and in the radio, I'm constantly asked these questions. So I wanted to get it out so that we can chew on it and all dissect it in. So when you're talking about the vaccination, all vaccinations are not the same.
Mhm.
There's a large community of people who are abject against vaccination for their reasons, and I understand their reasons. But I also understand that all vaccinations are not the same, and some are great. The greatest vaccine that we've ever made. Can you all answer the question? What do you think the greatest vaccine that we ever made for the world?
Polio.
Oh, polio.
You got it.
I was
You got
We
it.
are
about to say
scientists.
polio.
We're all in agreement. We're all in agreement. Now, if you remember
Polio.
back, and I don't know if they do this, I don't know if they do this, but you all are young. I got this gray hair on me.
Me
That's
too.
great too.
You got some, you got a little bit, that's a little speck. I see it. But this gray hair, if you remember when you took the polio, and I don't know if it's still doing that way now, what do you remember different about taking that polio vaccine?
I don't remember.
It used to be oral versus
Yes.
the oral vaccine at some point. Yeah.
That's it. That's it. You got it. That's exactly the point. If you remember, they gave it, and I don't know if they still give it in the oral form. As a child, I remember that sweet taste that it was. It was pink and it was sweet. And I said, oh, that's the vaccination. I go every time. Then the next time it wasn't so sweet because I got those MMRs. And you got shot with them. Right. And so what I'm getting at is that was the difference between those particular ones. What's the difference? And I'm not trying to, put y'all on like this is school, but what's the difference in the MMR and that polio? What was the difference in? We got a chief resident here.
One was live and one
You got
was...
it. You got it. So one was live and the other one was
I'm
dead.
still closer to school, so this is like
you close. So he good. He's getting ready on this stuff. So I'm giving him training.
Okay,
so,
I just want to make sure. I want to make sure my audience is following you, Dr. Mark Muhammad.
Okay, go ahead, please.
So I just want to make sure. So what you're saying is that what I sound like you're going to is that the difference between when our bodies make antibodies, the IgMs and the IgGs, the difference between that and then the vaccinations that sort of are artificially made. What you're saying is that a long time ago, those vaccines came sort of in a liquid form and were live.
Yes.
Now the vaccines are given to us and they're dead. Is
Correct.
that a good summary at this point? Okay,
yes.
So now we know that you're getting ready to explain to us the difference between something live going into our body, connecting with something that's live, and something dead going into our bodies, connecting with something that's live.
Correct. So that, So now what I'm stating is that when we were given that live, now that's a watered down live. It's not the complete virus. It's like, so it is watered down. So I want to make sure they know that. But when you were given that, your body had the complete aspect of exposure to the virus that's live. So that means that, let's say, for example, you denature the virus or cut it down and chop it up. Then you may be only fighting against the arms, only the legs, pieces of it, and not the whole virus. When your body has an immunity to the whole virus, it's more powerful, it's more effective. The difference between the dead ones, or the ones, particularly the ones that we're given injectable form, they have to have boosters. You have to have annual ones like the flu shot, and these are variable. They can vary. But if you have a target to hit multiple parts of the virus, your immunity is more complete. That's what I'm getting at. So if you have a natural aspect of exposure to the virus low enough that it doesn't kill you and that is in the field, you're going to develop an immunity to it that's lasting. Then they're going to have a test that's going to come out that's going to measure your IgG and IgM to determine if you have had exposure and if your antibody levels are high enough, because then you're going to have to ask that question. Are you going to be the one that's going to take that first vaccine that's out that has been rushed through with probably no FDA oversight, okay? And that's going to be risky. All right, so I'm just telling your listeners to listen out. The scientists here, the doctors here on the phone, they know here that we know that when you do this, it's going to be risk. There are going to be lives that are going to be lost as a result of getting through things fast. So if you have immunity and you've been walking around with it, I want the test to come out to measure what the immunity is first, because I want to be able to say, nope, I don't need that at this particular point. And until you perfect it, I then would say, now I'll do it. But there may be others that have no option at all but that. And I want to make sure your listeners understand the politics, what's going on, and to not be fooled by what's going on. But Dr. Cole, I want to pivot to you and get you in on the point, is that with pregnant women, because this issue relating toward the aspect of the infection has caused so many people to be afraid. Right now, we have people who are dead with COVID-19 that the the funeral homes would not come in and take them. They want the actual morgue to be separated.
Yeah.
They're not taking them. They're not even taking them to the funeral house. And they're stopping organ transplants. Okay. So we were told that it stops at the respiratory and the lymph nodes. With a woman that's pregnant and there's all that's going through with that. And I heard there was a baby that was infected one time, and I don't know how that occurred. Speak to me about the uniqueness of the environment related to a pregnant woman and COVID, and if she happened to be, what potential implications can occur with that?
So at this point, we are uncertain about vertical transmission. And let me define vertical transmission. That means whether or not, if mom is infected, if it actually crosses that transplacental barrier and actually infects baby. So we are now seeing cases. And so as of right now, my stance would be that there's probably very little vertical transmission from mom to baby. So that's a good thing. But the problem that we're seeing with infected moms and negative babies, so if you have a mom who delivers a baby today and she's infected and baby is considered negative as far as symptoms, what do you do with that situation? That's an issue that we're being faced with. Is any of you guys who knows, a brand new mom with a brand new baby, how do you separate a mom from her baby? True. So that is a whole nother issue that we are now being faced with as far as breastfeeding, as far as care, as far as who cares for this new mom while she's immediately postpartum. So for right now, we are not seeing vertical transmission. We are seeing some babies that are infected, but we're not really sure if they're infected immediately after delivery or, when this infection is occurring, but it does not appear to occur while mom has a baby in utero.
Okay, good. It's nice to
so
know
I
that.
just want to make sure I'm understanding, Dr. Cole. So it sounds like with you're saying that right now it's not showing that vertical transmission, that the baby is born with it.
Exactly.
Okay, I just want to make sure.
Exactly.
Okay.
Exactly.
But the problem comes in at is, what do we do if the mom has COVID-19 during pregnancy and at delivery, and let's say the baby is born asymptomatic? The problem occurs. Do we say, hey, new mom, you're not going to be around this baby for 14, 15 days
Yes.
while we isolate and just make sure that this baby is good, and the problems that can occur mentally, emotionally, all that with the mom.
Exactly. And they've also studied the breast milk in positive COVID mom, and the breast milk is also free of virus. So that's a good, good news as well too. So the mom is still able to breast or pump her breast, save that breast milk, but it's just the whole issue of, from a mental standpoint, emotional standpoint of separating a brand new mom from their baby.
Yeah. Wow. And not being able to have that contact, which is so critically needed after having a baby. Wow. Okay, Dr. Baymon. All right, so you're in the ER, right? Yeah. First of all, because I don't think I did this, thank each of you. I thank each of you. As I told y'all off camera, I think that to me, y'all are the soldiers, right? Y'all are the soldiers on the front line, right? You're going to battle for us, and you're risking your lives. You're risking being there for your families, to help us heal through not just COVID, but people are sick with other things. COVID, even though the focus is COVID, but people have other issues and diseases that need to be treated. And I just want to thank each of you for doing what it is that you purposed your life to do. I just want to give gratitude to each of you for doing that. But of all three of you, Dr. Baymon, if all three of you are on the front line, you had to go test the water first. You had to be the one to drink the liquid to make sure that it wasn't poisonous. You're on the front of the front line at the ER. Talk to us about that.
So, as an emergency medicine doctor, the last pandemic we had in the 60s or so, emergency medicine wasn't a formed, visualized specialty at that point. And so now we're trying to learn how, to deal with this, in our own practice. And I was a part of this before we really started to talk about this on the news and seeing patients with no masks, no gowns, total soldier ER. I mean, that's just what we do as ER doctors. We're just like, I don't need precautions. I'm just going to walk in the room. And now we're totally changing that mentality. But before we really knew what was going on with this virus, you know, there was particular parts of the department that were just, you know, just exposed because we didn't know people had coronavirus. We thought they had normal viral symptoms. And so trying to now move to a new state in the emergency department where we're gowned up all the time and we're masked up all the time and we can't really breathe sometimes because we have the mask on, and, you know, and those things have changed. And to not know who has it and who doesn't have it is the scariest part, but we protect ourselves. And the main thing about this virus that is, you know, utterly scary is these young people in their 40s and their 50s, their oxygen is just, they just cannot maintain a good oxygen reserve. And these are people who before were running, were, you know, moving around. And so that's the dangerous part. That's the dangerous part of this virus. And on the front lines, there is an attack that has to happen, you know, amongst these patients to make sure we are treating them properly, we're treating them well. But then there's also this part of yourself that's, you know, you want to protect yourself. And so the balance between those two things are critical, because sometimes there are critical actions that need to happen, but then you are at risk for exposing yourself. And not only myself, but nursing, PAs, we have coordinators. I mean, these are people that are, you know, on the front lines with us together amongst the whole healthcare community, and trying to keep everyone as safe as possible, and even the patients.
Gotcha. All right, so I want to go back, because I want to go back to some terms that y'all threw out. I think Dr. Cole, you explained what vertical transmission meant, so I'm glad for that. Dr. Muhammad, you talked about antibodies, which I do want to kind of go back to that, but Dr. Cole, you mentioned something about PUIs. Can you talk to me about that?
Yes. So PUI is a person under investigation. So everyone has, so honestly, my hospital that I work at, that's how we determine when we need to wear certain types of PPE, which is, you know, personal protective equipment. What's really sad is, you know, as we keep talking about, is we may not know when someone really has COVID. So you could still be exposing yourself and not have proper gear to protect yourself. So a person under investigation at my hospital would warrant you putting on the N95 mask, putting on some type of face shield on top of that, goggles, protective outer clothing, possibly boots to cover your feet, definitely gloves. The problem that we have in my hospital setting is we don't have enough equipment. We don't have enough equipment to be able to truly protect ourselves. A new thing, as I was mentioning to you, you know, every day we get more and more data that's, you know, either frightening or, you know, just kind of status quo. A newest dilemma for us that we've now been exposed to is, you know, there's a certain thing called second stage of labor, when a patient is actively pushing to get a baby out. An actively pushing patient requires, you know, there's, you know, different types of, you know, aerosolized particles coming out of their mouths as they're pushing. We don't have proper gear on when we're in this setting. And again, this patient may have COVID and just fall into that category of being asymptomatic. Now, if we think that they are a PUI or a person under investigation, we will have that gear on. But, you know, just in normal, regular deliveries, I don't have enough equipment to wear to protect myself from that situation.
All right, so this is my thing, because that's scary, and this is, you know, could this have been prevented? And what I mean by, not that the COVID-19 can't prevent that, maybe not, but as far as, because I've heard some other medical professionals also say that they don't have enough gear, enough protective gear. I think you call it PPE. Why don't y'all have enough protective gear? Is it that we just don't produce enough? Or
we don't have access to it. Right now at our hospital, each nurse has been assigned to one N95 per
Same here.
nurse.
Yeah.
So you have to hold on to that one N95 mask like it's gold. So you have to pick and choose when are you going to use that mask, because you will most likely need to reuse it. So you can't necessarily use it on every single patient that you're pushing with. And sometimes, I'm not sure how familiar you guys are with, deliveries, but sometimes you're pushing for hours. So can you imagine someone just spitting in your face or breathing hard or doing whatever they're doing for hours, and you're sitting there with just a flimsy surgical mask on that does nothing? I mean, it is a barrier. It does protect you somewhat, but to be exposed to that type of environment for hours, that's not, a safe environment.
Yeah.
Wow.
And just to advocate, I think the reason why we don't have enough protective, gear is because of supply, because of access, but also too because, and I have to echo a colleague I talked to, after I was on, in the ER last night. It's hospitals have been run by a lot of business people who don't see the need in stocking things and want to keep things at a small margin. And when you have things that operate in this pandemic, diseases don't operate in margins. We've seen pandemics for forever, since the bubonic plague. I mean, they are a part of society. They're going to happen. And so we should be smart enough in our technological savviness to be prepared and to be ready for these things. Biology does not care about your margin. Biology does not care about your supply, about your end goals. Biology will do what it needs to do. And so us as humans, we now have patterns of history. We have patterns of history that have shown us that these things happen. So we as humans have to be ready. And what we're seeing now is we as humans have made the common error that we always have made, which we do not look back at history and prepare for it the way we need to.
Yeah.
So we're not taking into consideration that, just like the seasons in the year, life has cycles. Pandemics have cycles, maybe with another name, but they come back again. And we've got to learn how to start to care for people more than we care for margins.
Exactly.
Right?
So true.
And stock up on those things that can protect, even if you don't need them today. Right? Wow. Okay. So it sounds like you've really helped us understand what COVID-19 is. And also you helped us understand that our bodies want to help us fight against it.
Yes.
Right? But in order for that to happen, we need a little exposure, but not too much exposure.
Correct.
And that we should heed the guidance of covering our nose and our mouth with some kind of cloth, woven cloth around our mouth when we go out into public, whether you're having symptoms or not having symptoms of anything.
Yes.
Like
correct.
That. Okay.
So this is going to change, and I think I know where you're kind of going,
okay.
Sean, is that what can we do in lifestyle changes and how we adapt that into our world.
Yes.
So I'm gonna give you some proof from what is going on in the Far East. So in the Far East, when you look at what the Chinese are doing, the Chinese have been doing this for at least the past 10 to 15 years. If you notice, there's also been a change in the type of wear that they have. There's wearable PPEs that people have that are fashionable, that are colorful, masks, and you see like, well, wait, why do you see this all the time with someone going out jogging? Well, they have a smog problem. We got a smog problem in America, but they also have had SARS and MERS, et cetera, go throughout their communities, that people realize that they have to change their lifestyle. We have been very lazy as Americans, being used to the standpoint of not washing and cleaning. We have a drug for everything. We eat the wrong food, about something spicy. We got anti-acid medications for heartburn. We eat high cholesterol foods. We got Lipitor. We got something that we can put for everything. We got a hand gel. What they managed to do is to incorporate it inside of their world to the point they have wearable body outfit or armor to be able to wear. And they have a social distancing that has always been a part of their culture. Instead of shaking hands, they bow. They have acceptable distance. Not a whole lot of public displays of affection that are out. unless you're behind with it. This is a painful pill that the world got to understand. And I think we reached the point for getting toward the standpoint of what you can do in terms of immunomodulators that can enhance your immunity fight against this. Number one, getting the right enough sleep.
Yes.
You have to make sure you're sleeping and not stressing. Much of the things that we do as physicians, averaging 3 and 4 hours of sleep. I'm seeing the OB in front of me right now. I'm not going to ask how many hours she has. I'm not going to ask the ER doctor. Okay, and the cardiologist on call, better not ask us because you're going to be surprised. But we need to get sleep. The people who are out on the front field, what I'm telling them is that if you need to rotate out your staff to the point that you give them fresh points of rest. Rest has a direct connection to immunity. Vitamin D, that's the sleeper. Most people think vitamin D is just for hard bones. Vitamin D has been notoriously low, really in our communities, and we have the melanin to be able to produce it. For some reason, our vitamin D levels are low, probably because we're not getting enough sun. All right, so sun exposure of vitamin D is important as an immuno booster. All right, vitamin C, can't say enough about that. Can't say enough about elderberry. Let me just stop on elderberry. Now, I'm one of those ones that I'm gonna look at the science of a lot of herbology and stuff and see if it fits, if it's there. Elderberry had a significant impact on the seasonal virus and really on SARS and MERS. That's a known fact that it was compared in some studies even against Tamiflu, and it won out. So now it didn't do much of anything for this, the coronavirus, but I'm just saying that you better make sure you got some elderberry, make sure you got some echinacea, okay? Golden seal, anything that won't harm you. And I even would add noni juice or Morinda citriflora. These are powerful anti-inflammatories that are immune boosters that can certainly enhance your ability to stave it out and be able to get past the infection point. So once you get that, again, your immunity is there, and those things are sound and been proven true with some data.
Yep.
Wow.
And I mean, and to that point, I mean, I am on the same page. I have to use my scientific brain because but like there are things that we got to start to embrace in this country, which is alternative therapy. We've got to start embracing things like mint, ginger, unsweetened cranberry juice, like not the ocean spray, but like unsweetened cranberry juice, pomegranate, acai. We have to stay away from these pro-inflammatory foods. This is McDonald's. They have all these hydrocarbons in these chains. Our bodies create reactive oxygen species, which then create more inflammation. We have got to start addressing health in a different way. And I think this virus is really helping us get there. And if anyone is listening to everyone's, I'm gonna echo everybody, like just every health alternative doctor, Dr. Mark Muhammad, everybody, Dr. Cole, like just everyone has got to we've got to start embracing health from the standpoint of pre-disease. Does that make sense?
Yes.
Proactive.
That makes a lot of sense.
Proactive.
Yeah. It sounds like, okay, you know, y'all know me. Well, maybe you don't, but you know, I've been on this thing, you know, that, you know, everything comes from what we call this earth, this physical thing we live on, right? And it sounds like this COVID-19 is sort of forcing what I think some of us have been on this path anyway, right? You know, especially if we're paying attention to our own bodies, paying attention to things going around, you know, on sort of and I'm gonna call it a natural path, but only because I can't think of another word at the moment. And kind of saying, okay, wait a minute. You, like Dr. Mark Muhammad just said, for every illness I have, there's a pill for it, right? But maybe we shouldn't take the pill. Maybe you should just adjust what you're doing, adjust how you're eating, adjust your physical activity, right? Adjust how you're thinking, right? Because we have been trained, right, to let's just go by McDonald's and pick up Big Macs and fries and a large soda, right? Whereas now it's like, darn, I got to think about what I got to cook today, right? But maybe I should do that, maybe right? Or, you know, oh man, my stomach is so bloated. Well, maybe you shouldn't drink so much milk, right? Maybe you should. You should start writing a journal and saying, okay, when I drink this much milk, my stomach feels a certain way. So maybe I need to either eliminate the milk, reduce the milk, or change what kind of milk I'm drinking. maybe it's time for us to start to pay attention a little more to ourselves and not buy into the commercial that says the pill's gonna fix it. Because y'all, not necessarily y'all, but these, I watch these pill commercials and the man is holding the woman's hand and
the music is playing.
And it's like, you take this pill and you're going to be all right. And then at the end, and it may cause heartburn, it may cause
get loud, and the music get loud.
And I'm like, okay, I don't want that pill, right? But but you've been lullabied, right, from the word of how they've perfectly scripted the words with the visual. Right?
Of course.
And I think we've got to learn how, and the coronavirus may be helping us, learn how to see past the visual and get to the meat of what is being said. And understand that, are you just being talked into something that's not going to actually benefit you, but it's going to make you addicted to another addiction.
Exactly.
Yeah.
Right?
Yeah.
Because the reality of it is, our bodies want to heal itself, right? But it sounds like we put so many other variables in our bodies that we are reducing the strength of the fighting machines that we are, right?
True.
And we need to build that back up, and that means we need to dump out some stuff, right?
Correct.
Right. And it sounds like we need to put in some rest and stop staying up all night if we don't need to be up all night. We need to put in get out in the sun, because the sun is our friend, right?
Yes,
right?
It is.
Right. And we need to get into some herbs, which basically need to get back to the ground of back to the soil of the earth. And find some of these herbs that actually really do work to help to help our bodies do what our bodies do for as long as we can breathe in and out, right? But that means we've got to start to think for ourselves.
Correct.
And stop buying into the stories that sometimes these commercials, tell us, right? I know I didn't buy into it, so I'm gonna get that pill. Right? That pill gonna do that, right? And not knowing that pill gonna cause some other problems. Yeah. All right, y'all. I got some questions. Now, I think we may have covered a lot of them, but I got a lot of questions coming in, so I want to just go through them. And if we've already covered them, you could say, I think we talked about it, or just give a quick answer if you think we've already kind of given it into detail. All right, so one question is, how long after you recover from corona should you isolate from others? Do we have a hardcore number for that number of days?
Okay. The first question is that what you just mentioned, the first part of it, after you recover. You said after you recover or after you confirm that you don't have virus?
Well, it sounds like now there's a difference based upon what Dr. Cole informed us. All right, so let's break that down. How 2 negatives to know that you've recovered.
Correct.
Right, Dr. Cole?
Yes.
All right. So what is that time frame? If you had to put a time frame on that, right?
I would still, and I'm just, of course, I don't think it's been written in stone. I would still assume another 2-week quarantine period from the time of being completely asymptomatic. And what we mean by completely asymptomatic is a fever without Tylenol for at least a 24-hour period, as well as no other symptoms. So I would do an additional 2 weeks after that point, just to ensure that you're still not infectious.
So it sounds like to me, Dr. Cole, and you're talking 30 days.
You may be looking at a 2 to 3 week period. It really varies. And the problem also, Sean, that we have is access to testing. Right now, that's our biggest issue, is that, in the ideal world, you think you can go get tested very easily, but that's not necessarily the case. We have some cases here in Houston that it's taking 10 days at least to get results back. So you may not even know for 10 days after getting tested that you're positive. So, that's a huge issue.
Wow. Okay.
So I would add to that exact what she just stated is that among us on the phone here, and of course your listeners, be it the fact that I've been in the radio and been exposed to people out in the community, people have tapped me as to connections. Right now, I'm dealing with a multi-million price order for masks that are in and out of the country. I'm dealing with those particular kits she's talking about now, that right now, the price has gotten down to around $28. I'm talking about the self kits that you're able to get a response back within 45 minutes. Now, what I envision is this: because the politicians and the lawmakers that are out there have not really caught up to what is demand, there needs to first be a conversation between those medical personnel and the politicians to be able to make proper policies relating toward that. So number one, I think, and I echo the fact that this is what they've done with the cruise ships in the additional 2 weeks. So she's right on board with that additional 2 weeks. So you're right, about 30 days. Now, imagine that this particular kit has to be at every restaurant, every doctor's office, everywhere, school, because what's going to happen is the plan to return people back into their work environment is going to have to be gradual. So you're going to have the maximum exposure of these particular ones, maybe drive-bys as they already are trying to do, but it's going to have to be a rapid test. Now, again, I stress back to the fact of what we all said. The test has to be done right, and it has to be validated. Because again, if you release people back and say you got a negative test, you can be infecting people newly or back again if it's not done right. So I worry about the application. I'm studying these particular kits to determine if they are truly going to capture that. But if they don't, they could be spurring up a whole nother issue of false hope to the point that you really have not properly contained it. So once you determine the person is, quote, virally clear, they still have to go back to their house. Their house and home may not be virally clear. Now, what they're doing in Israel, they are doing this for medical personnel and for individuals in general. They're checking them every 5 days. So they're doing an every 5-day check to determine if they have viral activity, because you may get it again. And once they get the point of that IgG or IgM test, they'll be able to then know for sure what your immunity is, because you then, only that way, you will know for sure that when you test, the person has an immunity and they won't spread and that they won't. So it's a little more complicated in terms of the answer to that question, but at least that's to give you information to know what's coming ahead.
Gotcha. Okay, so we touched on it a little bit, but I don't think we really nobody committed. I think we were all kind of doing this like, But y'all, I'm about to say, okay, when they come out with that first vaccine, are you gonna take it?
No. I mean,
all right, wait a minute, y'all. Now I have 3 doctors on the phone. Now, I'm not a doctor, and I'd already decided.
Well, here
I read way too much to take a first time release vaccine. But these are 3 doctors that are also shaking their heads. One of the questions was about this. I need for you to kind of, each of you, to address, your concerns about an initial vaccine and why for you and maybe for your family, your initial choice may be you would not take it if you didn't absolutely have to. I'm gonna start with you, Dr. Nichole.
So the first issue we all basically kind of agreed on: anything that's rushed, that hasn't been studied well, it makes you a little leery. You don't want to be the guinea pig for anything. You don't want to be in the first batch of people who have some anaphylaxis or some weird reaction to this to this vaccine that's newly formulated. One thing though I've been thinking about, however, is at this point we don't have a timeline of how much longer this is going to last, right? Mm-hmm. So we're thinking about, let's fast forward to the fall when kids are going back to school. How do we know if there is a vaccine by then? How do we know if there will be some type of mandatory kids need vaccines before they can come back to school, so that we don't have this pandemic start all over again? Because there's been lots of talks about a second resurgence of this virus. So, I'm seeing that this vaccine may be a hot topic very soon, Sean, because that might be an issue that they say, well, in order for us to get kids back in school, we need to vaccinate everyone against this virus. And I would feel very strongly against that. I would feel very strongly against vaccinating, having mass vaccination of a vaccine that has not been well studied.
Yeah, you just brought up a really good point. I mean, I didn't think about that. I mean, because if like when my child went from middle school to elementary school to middle school, she had to go get some some vaccines. And, it was like, oh, she need this vaccine, this vaccine, this vaccine. And I didn't question it, right? It was like, okay,
Exactly.
that's fine. But if you tell me for my child to go in the fall to school that or my children have to take a vaccine that's untested, untried, and then tie my child's school to whether or not I let her take this vaccine, and you're telling me she can't go until she take that vaccine, I'm going to have a dilemma, right?
That's a huge dilemma.
Because I'm really allowing you to use my child as a guinea pig and tying education to why I got to let you use her as a guinea pig. Yeah. So I think that you're right, Dr. Cole. I think that's going to be a hot topic for real, like a serious topic.
And
Dr. Baymon, what do you say about it?
I think it should be a serious topic in the context of, when we have this vaccine, a lot of people, if it is rushed, a lot of people aren't talking about the fact that this really isn't a pediatric disease, and it can affect kids. We are learning that, but, kids may be asymptomatic carriers to adults, and we don't know if they're causing adults to get infected. It's just a lot of unknown questions and stuff. And so it has to be a vetted process. It has to be something that is, it has to be thought out in how we approach from a vaccination standpoint. And so if it's something that's rushed and the government is trying to say like, oh, you have to do this to your kid, and if you don't, they can't go to school, I think would be not ethical, because it's something that we haven't, it's not ironed out, and that's not fair at all to a child.
Exactly. Well, being that these kids are at home now, we having to learn how to homeschool them. You tell me my kid can't go to school, I'll be like, okay, well, I'll just teach him myself then. I'll buy my homeschool program. I don't want to put them at risk. I don't want them to be the guinea pigs. Why don't you continue to test the vaccine a few more times, and then maybe then. What do you say about that, Dr. Mark Muhammad?
Well, I'm agreeing to all the discussions and conversations, because this is good. It's lively. Your show, I'm telling you, it's the bomb. It's better than CNN.
Yay!
Because this information, they don't have that out here. I'm just telling you. No, they don't have this right here. And this is what they need to do in here. This type of discussion like this is it. Now, before they get to vaccines, what they're doing now is there are a couple other options that are actually probably better than the vaccine option they're going to offer. And that is something called this BCG vaccine that's been out. Those that are on, the doctors know about that. This used to be the old TV treatment for those internationally. And what it does is it revs up the immune system. And side effects could be, swollen lymph nodes and things like that, site reaction. But it does what the herbs and other things are doing. It's teaching the body to say, rev up your immune system to be able to fight any type of viral or bacterial infection, etc. And then, of course, give you natural immunity to it. And by virtue of that, you still have your own ability to have it and not even need the vaccine, provided your titers of your antibodies are high enough. Now, again, it gets to be a legal situation, because I'm now going to pull to the great attorney, Fleming Bruce, because now you're dealing with the situation of what we as doctors have been pushed against with the usual flu vaccine that they keep talking about every year. They come and they yag our coattails and say, you need to push this to your patients. Take this, and then you're in the health field, you need to take this flu shot. But I'm going to just tell you this. If the flu shot, and I try hard not to interject controversy and these conspiracies in, but I'm going to have to put this one in. If the flu vaccine was 100% perfect and it worked, how much money would be out of the cold and flu and sinus medicines that are on the shelf? I leave you with that. It's not that we can't do it, it's that we have not done it, okay? Because it will be effective, and by virtue of that, it'll knock the common cold and virus out. But the problem is that you're dealing with an issue of money and business and big pharma. Just gonna put that out there. So getting back to the point, you have a non-vaccination option. You got immunoboosters. They're also taking serum from patients who have survived the attack and giving that. I don't know about you, but that seems also a little scary. What if they are not checking it for the HIV virus and other things, hepatitis? Those things are bad viruses too. Yeah, and so when you now push that out and say, now they are making the immunity in terms of legal protection in reach of those companies because they won't be sued, like 3M. It was the particular company in America that was making those N95 masks. Now they realize that, hey, I realized this before. In Lowe's, you can go and get the same type of mask that I got on the shelves, and they released the protection against being sued to say that it wasn't authentic N95. Okay, so I bring the question back to our moderator. How did she feel? How do you feel, LaShawn, about these legal implications and the fact of what fights can be really rendered on person that want to keep their children home, and this is a rule or law, or if you just say, I want to refuse this, because they're now removing religious protections against certain vaccinations, and it's getting particularly more difficult to say no to what's going on across the country.
Ooh, wow. Okay. So this is my thing. Okay. I've never, ever taken the flu shot, right?
Wow.
Just from a personal thing. I've never, ever taken the flu shot. And I've never actually seen myself as a conspiracy theorist. However, the reason I personally have never taken the flu shot is because I've always had this thought process that, okay, my body is a self-healing machine. I just got to try to do what I can to facilitate the healing. So that if I do get a cold, my body will do what it does, which is fight the cold. But better yet, let me help my body to be able to fight it before I even get a symptom. Or if I get a quick symptom, my body will knock it out. All right. So as far as the flu shot, I've never taken it. And every time I do go to the doctor every year, y'all just want to push the flu shot on me. And finally I have to just tell my doctor, I'm not going to take the flu shot. You don't have to ask me that question, right? I could come in here sick. I'm fine. I'll figure out how to get better. I don't want to take this because you're going to infect me with something to heal me. And there is, and because I do a lot of research and I do a lot of reading and I do a lot of thinking and non-thinking, I realize that there's systems that are set up, right? And there's the sick system, right? And the sick system is there's people that profit off of me being sick, period.
It's a
right?
fact.
That's just a fact, right? You can say, oh, yeah, sure, that's just a fact,
It's a fact.
right? And if they profit, and when you're profiting off of being sick, you are in the back room thinking about how can I do what?
True.
Make more money.
Chronic
How
care.
can I improve my margins? I think we were talking about margins earlier on, right? So there's a certain thing that I know that I'm not in a power position. I'm not a lobbyist. I'm not wealthy. I can't go get in the ear of the people who make the decisions, right? But I know that there are other people who don't have my best interest at heart that are lobbyists that can get into the people who make the decision makers' ear and get them to make law what's not necessarily to my benefit, right? So when it comes to, from a legal standpoint, what happens if you want to require legally me to do something that I don't think that's in my personal best interest or in the personal best interest of my family, whether it's health, emotional, mental, whatever, right? Then that's when we've got to, or each individual's got to stand up in their right to live on this earth without the rule of law of somebody else, right? Because to a certain extent, is if me saying I don't want to take this vaccine because at this point it's just not tried and true enough for me, right? And I'm willing to take the physical risk, right? Then you cannot, by stroke of a pen and the coordination of words together, take away my right over my body. So what we're going to have to see now is we're going to have to see a move of individual people standing in their individuality and in their right, to live on this earth and make a decision about their own body, right?
Wow.
If my decision about my body is not affecting Dr. Cole, is not affecting Dr. Baymon, is not affecting Dr. Mark Muhammad, then that means that's my decision. And you don't get to use any other rule of law to veto my decision. And when I decide that I'm going to submit to your rule, it is going to be because it coincides with my decision. And I think that it goes back to what we were talking about a little bit earlier about we have got to change this oven-baked microwave mentality that we've kind of grown into, and we've got to go back into the process mode of our own lives and start building new processes for ourselves, as opposed to saying, okay, well, I'm gonna give you this pill to fix it. No, the way I may have to fix it is for the next 6 months to the next year. I may just not be able to eat a McDonald's burger.
True.
Right.
Let me ask you this.
Those changes.
Let me ask you this, Sean. I'm sorry, and the moderator getting questions at her as well from those in.
I didn't mean to go there.
No, that's good. I'm asking you a question because you were educating us. I want to get something from this too.
Okay.
So everybody's teaching each other. This is in the back of my mind because I'm always thinking as well, like you're saying, the next step ahead. If this gets to the point, and it can very well be, to the point where martial law is instituted, okay, and maybe you can explain to us and the listeners what martial law is and how it's applied. But if martial law is applied because this is a pandemic, how protected is your constitutional right relating toward martial law when particularly a school or something is impelled to say you must take this injection, otherwise you either can't get your check or you can't do this and that, or you have to be quarantined to a location, et cetera, et cetera. How does that trump your, literally figuratively speaking, trump your personal constitutional right to life, liberty, and pursuit of happiness? Like, what argument can you make of that, or are you just defenseless at that point?
Whew, okay, that's a tough question. Okay, well, you know what? Actually, it's a tough question, and it's not a tough question. Okay, so let's go back to the constitutional right? All right, you do understand that the Constitution is a written piece of paper that that's the land of the law, so to speak, that we don't actually follow completely. Okay. Right. We don't follow the Constitution when it just comes to our monetary system. So let's get that out, right? Our monetary system should be based on gold and silver, but it's based upon debt. But that's a whole nother, that's not this podcast, right? But that's
a conspiracy one.
Okay.
Right.
No, it's not conspiracy. You can just look at the Constitution. It says what the monetary system should be, and we can look into what our American currency is and see that that's not our American system. Right. Thank you, Doctor. That was Nixon, I think, that changed that. But anyway, that's a whole nother conversation.
Wow. Right? Go ahead.
So
that's what I'm talking about. That's what I'm talking about today.
Right. So,
that's what I'm talking about.
But this is the thing. The thing is that you have your constitutional rights, but then you have other laws that sort of expand or explain, so to speak, what the Constitution was saying, right? Okay. Which basically means you have new law. Right? Because you can have one law that's interpreting something that the Constitution said, right? But no one really knows exactly what the Constitution means other than the people who wrote it. And I call them our founding organizers, right? They're the ones that wrote the Constitution. So only they really know what they mean. Now we can interpret what we think they meant, right? Okay. But they're not here today dealing with COVID. And dealing with how COVID is changing what we thought what was normal in life.
True.
Right? And so what we have to be very, very mindful of is politicians taking your liberty, your right of existence away. That's what we have to be careful of, right? And so if they do make a law, let's say they say you have to take the vaccine, then you have to then argue your constitutional right to say no. And you're going to have to make a decision of whether or not, how far do you want to take it, right? Yeah. Do you want to take it to the point where your child won't be able to go to school? Okay, well, if your child won't be able to go to school, because there's already a law that says you can homeschool your children, right? At least in Texas. I think that's probably true in every state. Well, then that's when parents got to get together and say, wait a minute, just like they created that school, we can create our school, right? So we've got to get back into creative mode. So if they do something that says that we don't want, that we think is harmful to our children, then we've got to be willing to create something new so that we give still to our children and to ourselves maybe what the government won't give to us. And this is why I warn people, nothing that they give is free. Not money, not food, not benefits. It's not free, right? You're gonna pay for it later. So be mindful of that and just make sure you are willing to pay the cost to that. But I think you stand by your constitutional right to say no, right? And then all they're gonna do is create a new law to try to say, okay, well, this is a new rule. Well, then now you got one rule that's going up against another rule. And that's how you have to handle it, because that's the way laws are. You got the Constitution, you got regulations, you got state laws, you got all of these laws. And then all you can do is just say, okay, I think this law violates this law. And I think this is the law that gives me the most expansive rights. And I'm telling y'all, we need to be for laws that give us the most expansive rights, not laws that restrict, right? Sometimes politicians can make a law seem beneficial, right? But it's beneficial in the moment, but it's restrictive in the long term.
Wow.
And don't be so quick to want to restrict my rights, right? That you cut your feet off. Okay, so that's how you have to look at laws. So hopefully we are strong enough as a people, and we're waking up as a people, that we won't allow these politicians to make a law that requires the vaccines to be an absolute, but a choice.
Yeah, well, and I mean, I'm like, there's certain particular parts of vaccines that are necessary and help us, eradicate disease. And I think this will be an interesting time in law, because it'll be something that will be pushed to kind of think that the benefit is immediate. So I don't want to come off as anti-vaccine. I support vaccines. The flu vaccine is a whole separate argument. You can do a whole podcast on the effectiveness of that vaccine particularly. But like polio and MMR and Hep A and Hep B have helped really, decrease, the rates of those, diseases in this country. But I'm not about to take just the first vaccine you just throw out at me if it's not vetted in the right process. And so this will be an interesting history lesson for all of us, and an interesting part of our history, because this will kind of change a lot of, I see everybody's point, this will change a lot of how we approach. Because you're not about to just inject me with anything, right?
Exactly. Yeah. And that's the thing. I'm not against vaccines. Like I said, our children go to the doctor to get vaccines. I let them get it. I'm against me taking the flu vaccine, but that's me. That's my personal thing, right? Yeah. But my children get vaccines with no issue. If I think that y'all are smarter than me, right? To that extent. So if y'all say they need vaccines, I'm with it, right? But I don't want to be a guinea pig on something that I know is rushed, so that you can go back, so that the markets can open up again, so that people can make profits again, right? I want to wait on that. What's your thoughts about that, Dr. Cole?
I completely agree. I mean, even, we in our industry, we vaccinate against HPV. And even with my own children, I waited several years before I actually had my kids vaccinated. So that's my whole thought process on any vaccine. I sit and I watch it for a year or possibly two, just to see, what the true reactions are. Most vaccines are studied for years before we actually, initiate them here in the US. So just to know that this is something that was just made a month ago or a few weeks ago, I'm not gonna be on board with that for a while.
Yeah, exactly. Yeah, and I think this is one of those situations where you stand up, right? You stand up and say no. I mean, people have to think about it like this, and not to go too black on this, but we would still be enslaved if somebody wouldn't say, hey, I don't want to be this term anymore, right? I don't want to do this anymore. I don't want this anymore, right? And then stand up for that. And if that means, well, I die, then that's a part of my life cycle anyway, right? We got to stop being afraid of the life cycle, right? And then we got to do what you said, Dr. Baymon. We've got to start to look at cycles of life. Things happen in patterns, right? And we could have been prepared for this if we wasn't so focused on the margins and was understanding that, okay, we may not have had a pandemic in 100 years, but we know it's coming. Let's make sure we got these things stocked up, right? That's called caring for mankind. And that's what we got to get back to do. All right, let's go back to these questions. I want to make sure, because none of my people saying I didn't ask y'all the questions. I'm gonna have to bring y'all back on the platform. All right, so I think Dr. Mark Muhammad, you answered this. Somebody said, does high doses of vitamin C provide support to someone with COVID, or to try to keep off COVID?
It helps.
Yes, it helps.
Yeah, it helps, but it does not cure. And beware of extra high doses like above, usually 400, 500. Don't go above 1500.
Okay.
You may have irritated stomach, stuff like that. But the data is in between those doses.
Gotcha. Okay. All right, so this is, I think you've asked this about answered this, Dr. Cole, about pregnant women. Somebody answered this. Somebody had made the statement that said, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Disease, stated that the virus is likely to come back in the fall, winter. I think, Dr. Cole, you kind of talked on that, and you said that is a possibility.
That is a possibility.
So basically, trying to keeping the tightly woven thing around the mouth. We're going to probably be doing that for a while to come.
Yeah, I think this is really going to change, as Dr. Muhammad said, the way we interact with people for a while.
Okay. Okay. And Dr. Baymon, you did this thing like this, I think when Dr. Muhammad was talking about stuff that was going in the channel. Is that like some type of gear that you can buy that covers?
Yeah. I mean, a lot of countries will have those things where, in terms of America, right? If you go to gyms, I love to go to the gym. I love to work out, right? There are things that people wear in other countries that are different from us. Like we have, shorts and tank tops and are very kind of revealing, but there are people who kind of go out and call clothes and they take these jackets that come all the way up to here. So they're protecting their respiratory system because they have risks of transmission of disease. Gotcha.
All right, this is kind of probably more of a personal question for y'all. It's basically, how has the COVID-19 virus affected your lives and your outlook on life from a personal standpoint? Let's get a little personal here. Let's start with you, Dr. Cole. How has it affected you?
Well, what's interesting is it's changed my whole outlook on how we function as doctors. I've changed my booming, busy waiting room to just a waiting room of 10 chairs only to make sure that I'm truly keeping that social distancing in my waiting room. I like to greet my patients sometimes with a handshake or a hug. Can't do that. So I feel like I have this barrier between myself and my patients now. I took a picture of myself with a brand new baby I delivered 2 days ago. I'm with my mask on and I'm thinking this poor baby 10 years from now is going to wonder, why does the doctor look like that? Why is she completely covered? All I can see are her eyes. So it's just, it's just our outlook on everything. I feel like I'm walking, not trusting, the environment that I'm in. I'm looking at everyone. If I hear someone cough, I look twice at them and I think, was that just an allergy cough or was that something that I need to pay attention to? So it's a very uneasy feeling. The first probably week or so, I had a lot of uneasy nights and just restless sleeping because, it's a scary thing. Every day you go to work, you're potentially putting your family at risk. And so that really gives you some guilt. But part of our, Hippocratic oath that we take as doctors is we provide care. This is what we do. This is our lives. But it's a tough feat right now, just not being prepared, not being as safe as what we should possibly be, and just not knowing what's going to happen.
Gotcha. Wow. What about you, Dr. Baymon?
It's definitely, affected how I interact in the emergency department now. I mean, we wear our masks and our N95s and our shields all shift. We can't drink on shift, and I'm used to drinking about a half a gallon every shift, and that can't, like a half a gallon of water, and that can't happen anymore. Also, too, just how I interact with all of my patients. Just like Dr. Cole was saying, I used to shake their hand. I used to give them hugs, and now I can't do that anymore. And also, too, now, before we even walk in the hospital, we have to get a COVID pass. And so we have to put in this website to say, I have no symptoms. And we get a pass, and it says, you're cleared to work. I show that to the security officer. I show them that I work there, so I show them that I have a badge. And then I go in, I take some gel I have to wipe my hands, and I have to put on a mask before I even go anywhere in the hospital. And then from a personal perspective, I mean, I'm used to going to breakfast after an overnight. Can't do that anymore. I'm used to going to the gym at least 6 times a week, and that doesn't happen. So just trying to adjust around that and de-stress is changed significantly. But I think the change isn't bad. It's just a change. And if you can't accept the natural adaptability in changes that occur in life, then, like as a biologist, as a scientist, as a doctor, everything is you have to be adaptable. And one of the things that we learn, in terms of our principles is adaptability is key.
Got you. What about you, Dr. Muhammad? How's it changed your life?
Sure. Well, definitely in a professional sense of the word, like they stated, those aspects of distance between the patient. But I've actually also really loved the experience of telemedicine and telehealth now. It's transformed the fact that what I thought about as a dream now and seeing my patients from home, I'm looking into their houses now. I'm seeing more about them. They love it. I thought they would not like it. They love it. I'm actually able to look around and see what they're eating with the home health nurse. And so it's a great thing in terms of adapting how we really should practice. Older patients shouldn't have to go out and freight outdoors and be risk everything and all to get to your office if you can manage them at home. Just yesterday, we had a patient who had a blood pressure of 260 over 120, and she did not answer any calls. And the nurse said, well, let me just drive by there and go there. She did. And we caught her there. She was having chest pain, pressure. We were able to lower blood pressure without bringing her into the emergency room. And that right there really totally transformed the fact of we really should have been doing this all along. I think the COVID virus is a reset button for many things. For my personal family and a personal standpoint, I'm seeing my children more in home. I'm able to interact with them. I see how much they've grown in the sense of just the time period I thought I knew them, but I really don't. There are stress points, and this is the reality, you all out there. There's more stress within your marriages, your relationships, because you're under each other more. The distance points are now removed. So you're like, golly, you do snore. God, dang it. You're dealing with a lot of that. And the reality which is that take the time, push away the video games, pull them into the room, put something out, pray, try to do things in an order that enriches them and their understanding. Right now is a project I'm trying to get my girls to make the cloth masks. So we're going to give them as a donation to the nurses. I've been buying masks and giving it to the nurses in the hospital. We're going to give them cloth masks. This may be a business venture. So we're doing all types of things to kind of expand the education system. But yes, it has totally changed my life, and I know many others, and we will never be the same. Not even thinking about McDonald's or any other food points. Wow, I got a taste for this, so that's it.
Wow. I see you got your mask on, Dr. Baymon.
A cloth mask.
Cloth mask.
There you go. There you go. Oh, yeah, look at that. That's nice. Oh, you made it. There you go.
There we go.
Well, let me just again, I want to thank, I think we've covered all of the questions. Okay, well, I do have one question. Someone mentioned that in Sweden that they were trying to implement sort of like the herd mentality. I guess that's trying to expose people, through to the virus, but in a herd mentality way where they don't have any restrictions, no rules. They just kind of feel like if the groups of people are exposed, it won't have as damaging of an impact, right? What do y'all think about that? About the approach that Sweden is taking? They have down no quarantine, no distancing rules. What are your thoughts about that?
I think that's an awful idea in several aspects. As I mentioned earlier, 80% of us who might get exposed to COVID will probably bounce back and not have any issues. 20% will not. 20% will have, serious ramifications from this, including death. So I think that's an awful idea because why expose people to it if they don't need to be exposed to it? Why do we subject people to possibly dying over a virus that their body cannot fight? We all have different medical histories. And as you mentioned, diabetics, asthmatics, several patients with other comorbidities don't respond well to this virus. I think that's a bad idea in my opinion.
Dr. Baymon, how about you?
It's a very bad idea. Simply put, I think the way Sweden is approaching it is not ideal. A lot of Swedish people, in terms of their government works differently. We've known from a healthcare perspective, a lot of them have a very kind of homogeneous type of healthcare and like a phenotype, genotype. And so they're a little bit more alike than people in this country. We have people from all different parts of the world. In America, we know everyone's different. And the Swedish populations can be very homogeneous, which may, benefit them or may not. But it is just not a great way to approach this disease process when we know it's so virulent. But that is not a recommendation.
That's the Swedes, huh?
It's the Swedes. I mean, honestly, if we want to like be a little bit jovial about it, I mean, it's the Swedes. I mean,
Yeah.
That's just, and they're not gonna leave. They're gonna stay. They have a great environment. They have a great, government. They have great jobs and money. They're just gonna stay there and quarantine from the rest of the world, and that'll be it. They just will lock down Sweden, which is what they're gonna do. But it's not a great way to approach this disease process at all. Not recommended by any physician.
Gotcha. What about you, Dr. Mark Muhammad?
I totally agree with them. Unless you want to kill off your elderly population and depopulate, unless you want to have a situation where you eliminate 20% of your population and cut your costs. But the reality which is that there are other hidden costs that go with that. And I want to make sure that the financial process of this and what it's doing to the country, the world, needs to be also stated on your podcast. And that is, people think about, okay, people are out of job, out of work. But the reality which is there are small businesses, there are self-employed individuals. I'm dealing with some of the issues that are dealing with the banks. And I know we don't have enough time to get into this. But again, you're going to have several podcasts. But I'm just going to say a lot of these things that were promised in that $2 trillion, stimulus plan or whatever that came out, immediately they started retracting. And the small business loans, I went to my two bankers and said, okay, I want to pull out the loan. I've been doing business with you all for 10 plus years. They said, well, we have a national hold on all loans. They're small business loans. And I said, say what? They said, yeah, because the actual application was too simple. And they were fearful that they were going to commit fraud relating toward these many loans going out. So it hurt everyone. If we have certain businesses that have 1099 employees, they're affected because they don't have the payroll traditional one. And so they're sending checks by virtue of the direct deposit, but those individuals have to then fill out a separate form, and then it could be up to 3 or 4 months before they get their check. Now, I've been keeping my office open because of the standpoint we have tele and other things that we're doing. And imagine recreating your office again. And I wanted to ask each of them, particularly Dr. Cole, because she has more of an outpatient. Imagine if you had to put on unemployment, all of your staff. Mm-hmm. And then when you open back up, then say, okay, we're ready to open. Will you find them back coming into your office again? Both on the standpoint of, hey, I got a check. I don't need to come in. I'm doing good. Supplements are there. All right. And then how can you retrain your new staff in time enough to meet the challenge that goes with that? We have a huge amount of issues that we have not even begun to understand what it has done to us. But certainly open the country up wide open unless you just want to depopulate and say, those who survive 30 days, we good. Come back out, but you still have to interact with the rest of the world. And you better hope that your immune system is ironclad strong, because if you get any type of variability of that virus and it mutates, all that's off.
Wow. Okay. Whew. All right. We can't cover it all, Dr. Muhammad. We can't cover it all. Can't cover it all. I'm going to have to bring you back on the platform to discuss that. I do want to thank each of you for coming onto the platform. I do have this treat of knowing that each of you are my family members. Dr. Cole, Dr. Baymon, Dr. Mark Muhammad, all of you are my family. I appreciate each of you. Y'all are awesome. And I just want to thank you. Thank you, thank you, thank you. This is Sean Speaks, and I am going to bring an end to this podcast. I think we may have to come back and do a part 2. Please definitely check out our blog post at freeyourthinkingmind.com and our podcast, Up Talk My Life on YouTube, or Free Your Thinking Mind on Podbean. Ashe, free thinkers, ashe. May what
Ashe.
you say
Be it so.
manifest in your life today and every day. Ashe. Stay healthy.
Ashe.
Stay healthy. Bye.
Stay healthy. Bye.
Bye.
All right. Bye.
Bye-bye. I'm
You still recording?
yeah.